In this video, I want to discuss some of the structures of the female reproductive system from the insert from one of our torso models. We can see the urinary bladder, then posterior and slightly superior to the urinary bladder, we can see the uterus, and then posterior to the uterus, we can see the rectum. Now, on this model, I want to point out the broad ligament, which is the blue structures, but they have cut portions of the broad ligament away to show some other structures. However, there are some of the other structures that we pointed out on our other reproductive model. We can see the broad ligament widens to form 4 different named ligaments, 2 of which are easily seen on this model. This one here is known as the ligamentum teres uteri, or the round ligament of the uterus. It is part of the broad ligament. It will go from the side of the uterus and it will pass out through the inguinal canal and down to the labia majora of the female. Also, although we only see a little spot of it here, passing from the lateral aspect of the uterus up to the ovary, again in light blue, we see the ovarian ligament. The ovarian ligament helps hold the ovary in place. So here we see the ovary, the gonad of the female. Coming from the side of the uterus, we can see the uterine tube. The narrow portion beginning as the isthmus, then the main body of that uterine tube known as the ampulla, and then it widens as the infundibulum. And then on this model, if we look carefully, we can see the fimbriae hanging down over the top of the ovary. Now I'm going to mid-sagittally section this model, and we will talk about some of the other features that we can see. We can see the pubic symphysis, and in the female, the pubic symphysis is overlined by a large fat pad known as the mons pubis. Recall that the male does not have a mons pubis. Immediately posterior to that pubic symphysis, we can see the urinary bladder, and if we look closely inside the bladder, we can see the rugae and the trigone. We also recall that the urinary bladder muscle wall was known as detrusor muscle, and we can see the urethra of the female. Keep in mind the female just has urethra. The male had 3 named regions of the urethra. Immediately posterior to the urethra, we can see the vaginal canal, and the vaginal canal has rugae to allow for distension of the vagina. And then as we get to the inside of the vaginal canal, we meet with the uterus. Remember, the cervical region of the uterus is in the vaginal canal, or projects into the vaginal canal, but most of the uterus lies on top of the urinary bladder. And here we can see the anterior fornix and the posterior fornix of the vaginal canal as it seals around the cervical region of the uterus. On this model, we can see the external os of the cervical canal, but we really do not have many clues as to where the internal os would be and where we go from cervical canal to uterine cavity. We also have a hard time on this model making out the difference between the myometrium of the uterus and the endometrium of the uterus, so we kind of have to use our imagination on this model. The other structure that we could see on this model was the glans portion of the clitoris. Immediately below the pubic symphysis and posterior and somewhat inferior to the mons pubis, we can see the erectile tissue of the glans clitoris.